Good day, everyone. My name is Jerrod Brown, and I'm the presenter for today's webinar presentation that is titled Trauma-Informed Care, a brief review for professionals. Below is a brief copy of my professional biography. At the bottom of this slide is my email address. Please feel free to send me an email if you have any questions about today's webinar presentation. Below is a copy of today's training description, along with the key learning objectives. We're first going to start out with just a basic overview of trauma. And trauma can really impact many, many domains of functioning. It can impact the way in which the individual feels safe, how they really think about the world and feel and behave, and their coping strategies, and how they interact with people in social and interpersonal situations. Trauma can result from many different types of situations. It can result from an event. It could involve a series of events, repetitive types of trauma. Very important to be aware of the topic of complex trauma. The adverse childhood experiences research. Trauma can be widespread. It can be harmful in many capacities. And without a doubt, it is a costly public health issue. Some of the different dimensions of trauma that you'll find in the research literature, or you might hear the term developmental trauma, historical trauma. You could hear it referred to as intergenerational trauma. There's repetitive chronic types of trauma, complex trauma. It could be produced at the community level through structural violence. Trauma reactions can really vary from person to person, and it can absolutely interfere with all areas of life. Their sense of safety, self-efficacy, the way they navigate the world, their emotional regulation abilities. Trauma may contribute to higher levels of shame, trust issues, confusion, helplessness, feelings of frustration, hopelessness. Very important to understand these topics. Trauma could rob someone of their joy, their creativity, their energy, their motivation, their self-control. It can impact their sleep. So it can really impact them on many, many levels. If you want to learn more about the topic of toxic stress, we offer a webinar on this very topic. But when you think of toxic stress, think of those cumulative, repetitive types of toxic stress that can activate that body's stress response system and really have a negative impact on that individual's developing brain and body. Many examples of different types of toxic stress: abuse, neglect, poverty, exposure to violence, household dysfunction, food scarcity, caregivers with mental health problems, substance use issues. When you work with people with histories of trauma, look at significant life stressors. What kind of conflict have they been dealing with? Is there divorce, high conflict divorce in their history? Separation from birth parents, mental illness history, substance use history. Have they had a history of poverty, homelessness? Looking at the medical health components to this as well. So very important to be aware of this. We also offer a training just on the topic of the adverse childhood experiences research. If you want more information about the original ACEs study, I would recommend going to this website. But when you think of the adverse childhood experiences research, think of traumatic events that occurred to that person before the age of 18. And again, it can occur in many different forms, and it can result in dangerous levels of stress. So that toxic stress exposure. And when that chronic stress becomes uncontrollable to that child, it can lead to chronic inflammation. It can have, without a doubt, a significant negative impact on the developing child's brain and lead to a host of social, emotional, behavioral, and physical health issues. But it's also extremely important to also consider the topic of prenatal trauma. Very important as well. Was that child exposed to any trauma in utero that also impacted development? In the era of COVID-19, these topics are very important. And actually, there's studies coming out that are looking at a possible increase in adverse childhood experiences during COVID-19. And when we think of COVID-19, think of the stress, the loss, the uncertainty, the worry, the fear, the change. All of those things can negatively impact that child. But when we look at just early childhood trauma, again, that can have a negative impact on that person's mental health, their physical health, the behavioral health. It can have significant implications for learning as well. Another article just to be aware of, with people with higher adverse childhood experiences in childhood may grow up to have higher rates of disease. Disability, unfortunately, could have higher rates of early mortality. There is research too to show that people that have higher ACEs scores will grow up to have higher levels of depression, insomnia, post-traumatic stress disorder, anxiety, possible eating disorders, conduct problems, substance use issues, a host of physical health issues. So very important to consider this, and especially in the era of COVID-19 now. We could spend a lot of time just on child development and trauma, but children who are exposed to trauma in childhood, particularly during those critical points of development, they can have a negative impact on that child's ability to relate and interact with their peers. It can have a negative impact on their playing behaviors. Creativity, it can impact problem solving. Academic development can have a significant impact on executive functioning capabilities. Theory of mind, I often talk about that. It can have a negative impact on theory of mind. It can impact their overall ability to stay resilient. So we want to be aware of resilience. Be aware of prenatal development too. We want to promote prenatal development. Very important. A lot of common sense things, but obviously ensuring pregnancies are free from drugs and alcohol and tobacco products. Stress management is so important. Maintaining adequate blood sugar levels, avoiding harmful environmental toxins, making sure staying in regular contact with medical health providers, promoting proper sleep, promoting nutrition, and even promoting positive dental health. So very important things to be aware of. Trauma exposure can have significant impacts on that child's cognitive and mood capabilities. So we want to be aware of that. So again, looking at executive functioning capabilities can be impacted. Can have significant impacts on behavioral and emotional dysregulation. We also offer a webinar on self-regulation deficits. I encourage you to take a look at that. But children who have more behavioral and emotional dysregulation may be at higher risk for aggressive types of behaviors. They could overreact. They could engage in oppositional defiant types of behaviors. Very important. Being aware of some of the trauma symptoms, having a good familiarity with the different disorders in the DSM-5's trauma and stressor-related disorder chapter. So reactive attachment disorder, disinhibited social engagement disorder, post-traumatic stress disorder, acute stress disorder, adjustment disorders, being aware of the ICD-11's diagnostic criteria for complex PTSD. Very important to understand the impact shame has on children. Shame is a toxic emotion. We want to be aware of the interconnectedness between trauma exposure and shame. Is that child or adult feeling like they don't have self-worth? Are they engaging in negative self-talk? Do they have a lot of self-doubt? Are they self-critical? Feelings of helplessness? High levels of shame can contribute to self-regulation problems. It can reduce that person's confidence and really have an impact on academic performance as well. So shame is such an important topic. Without a doubt, trauma exposure can contribute to a host of sleep problems. So it's very common. In some cases, it can be long-term types of sleep problems. Sleep issues in and of themselves can exacerbate short and long-term negative health outcomes. We want to be aware of sleep deprivation, the impact that has on day-to-day functioning. Nightmares, hyperarousal, bedwetting in some cases. We want to be aware of that. There's a lot of factors that can influence sleep, either positively or negatively. Looking at medical factors, possible hormonal influences, nutritional considerations, looking at the environmental and stress-related factors. So really be aware of that topic. Bullying and teasing, very important. Chronic bullying can contribute to negative long-term outcomes and have a negative impact on child development. Bullying can really come in many different forms and shapes and sizes. Physical bullying, there's relational bullying, there's verbal bullying, there's even material bullying as someone stealing or damaging the things of the person. And now in the era of COVID-19 and prior to that, of course, looking at cyberbullying, we really want to be aware of that because there's a lot of emotional and mental health effects that can result from bullying. Be aware too of self-destructive behaviors. If you're working with children or adults with a long trauma history, are they starting to engage in unhealthy coping strategies? Deliberate self-harm, are they starting to use drugs or alcohol? Smoking, unhealthy eating habits, are they starting to engage in compulsive types of computer gaming? Are they engaging in chronic avoidance of people? As they get older, are they starting to sabotage relationships? Be aware of this topic of self-destructive behaviors, very important. If you're working with adolescents with just dysregulation in affect, they may be more reactive, impulsive, they could be more depressed, disassociation, numbing type behaviors. We want to be aware of this and the role of trauma as well. Plenty of research to show adverse childhood experiences can lower school achievement performance. We want to be aware of poor academic performance and the causes for it. There's a number of internal causes, looking at problems in the home, but looking at some of those external causes too: poverty, homelessness, family violence, excessive screen time exposure. When we introduce trauma into this equation, it can exacerbate a lot of these issues I'm talking about today. Be aware of trauma in the classroom and how children with a higher adverse childhood experiences score may be more likely to have higher levels of suspensions or expulsions from school or being held back or having problems just interacting with children. It could be a risk factor for language delay. In some cases, they may be assigned to special education classes. So we want to be aware of that if you're an educator. Children who are impacted by trauma and in the classroom, in some cases, when the trauma has not been detected or identified or screened for, this child may look like as if he has ADHD. They could come off as having conduct disorder or oppositional defiant disorder, looking at reactive attachment disorder or disinhibited social engagement disorder. So when children are exposed to high levels of trauma, they may have higher levels of depression, higher levels of fear. They may be more fatigued. They may come off as indifferent, poor concentration, memory impairment. Teachers really need to be aware of this as well. Children who are diagnosed with post-traumatic stress disorder and during the time of child development, this can really have an impact on their self-regulation abilities and contribute to higher levels of aggression and tension problems. They may zone out in class in some cases. This could lead to, in some cases, mobility and motor problems. This could interact the way in which they play with other kids or are performing in gym. That could lead to higher levels of bullying and teasing. Regardless of the profession you work in, we really want to be aware of potential trauma triggers, loud noises, bright lights, how confusion can be a trigger, chaos, changes in routines, transitioning between topic to topic, really being sensitive to that. Being aware that some children may come from chaotic family system environments. Are they exposed to abuse and neglect and trauma and abandonment? Are they living in an unstable environment? Are they on the verge of homelessness? Do they have a parent or a caregiver with drug or alcohol or mental health problems? Really want to be aware of that. Working with children who are dealing with psychological trauma, again, they may demonstrate negative emotions. We want to be aware that in some cases, they may feel alienated. They may have dealt with betrayal trauma. They may feel criticized or ignored or misunderstood. They may come off as very tense. They may feel like the world is very unsafe. So, in a school environment, we really want to be aware of that. In some cases, these children may start engaging in self-defeating behaviors and attitudes. They may have that major fear of being abandoned or rejected or feeling alone. That can lead to self-doubt and impact their self-esteem and really get in the way of goal planning and decision making and problem solving. Be aware of psychological trauma in children and how it could contribute to feelings of being overwhelmed. And if that's the case in school, they may start falling behind. They may be very impatient and engage in really poor time management, poor planning, and just being aware too for the triggers for poor mental health in these populations. Very important we're aware of all of these topics. Learning difficulties, again, exposure to childhood trauma and prenatal trauma can really alter parts of the brain that are responsible for learning. And some of these symptoms you may see in the classroom or in that school environment could mimic symptoms of ADHD. Without a doubt, this can contribute to sleep problems. And we know when children are chronically sleep deprived, it can really have a negative impact on learning. It could lead to an increase in self-regulation problems. Going back to that previous slide, are they starting to engage in negative thinking and self-talk? Being aware too of the topic of hypervigilance, hyperarousal, being aware that fight, flight, or freeze response. Without a doubt, we need to consider memory capabilities. Do they have the ability to think logically, analyze problems, decision-making capacities? And unfortunately, childhood trauma can contribute to a host of physical health issues, increases in headaches, stomach aches, all of those things. Poor self-regulation can negatively impact school readiness. So we want to be aware of the different dimensions of self-regulation. How does that child regulate their emotions? Can they stay motivated? Can they regulate their attention? Do they have the ability to regulate their behavior in social interactions? Can they really regulate their physical behaviors, or are they just bouncing off the wall completely? When we think of self-regulation, think of those affective domains. Do they have the ability to understand and manage one's feelings or recognize and really label the emotions of others? We have the behavioral component of self-regulation, impulse control. Can they stay persistent with a particular task, or they throw in the towel? What is their level of frustration tolerance like? And do they have the ability to really delay gratification? And then you have those cognitive components, those executive functioning domains, working memory, attentional shifting, focused attention, planning, problem solving. Very important for us to be aware of. When children are dealing with self-regulation deficits in the classroom, they could come off as showing higher levels of aggressiveness in some cases, higher levels of impulse control problems. They may be more hypersensitive. They might have more frequent temper tantrums. So being aware of that and how that it could be very problematic in the classroom. As we move into trauma-informed care, specific strategies, think of trauma-informed care. Are we as professionals and the organization that we're working with really support healing? Does it support positive growth and change? Are we aware of trauma? Are we sensitive to trauma? Do we understand the impact trauma has? Promoting that feeling of stability and safety. It's important too for organizations to become culturally competent. We want to really collaborate with the client. We want to encourage, promote. We want to emphasize the possibility of recovery, being positive, encouraging, motivating. Very important. When we think of trauma-informed care at that organizational level, it really is from bottom up. Everyone in the organization, from the CEO to the person answering the phones, becoming trauma-informed. It's really a systems level intervention. So looking at your policies, your practices, your procedures, and are you doing this through a trauma-informed lens? Are you offering trainings, strategies, resources for the organization? Are you being aware of any practices or approaches that could reactivate the trauma in the people you're working with? I think it's important too to promote self-care, understand the importance of resilience, thinking of it from a strengths-based approach. I think is very important. Other components of trauma-informed care really focus on self-regulation. I think very important as well. Looking at your screening and intake practices, your assessment practices, your goal planning practices, very important. So we want to sustain trauma awareness. We want to increase our trauma knowledge, our trauma skills. This can be done through trainings, reading literature, consultation groups, hiring a consultant to work with your organization, hearing stories from other people, just learning, growing, having a mindset of growth, very important, collaborating, utilizing the best available science to us, evidence-based practices, looking at the empirical-based data, very, very important when we think of trauma-informed care. So again, kind of pulling all of this stuff together I've talked about today, when we think of trauma-informed care, are you and is the organization you're working with really promoting a culture of empowerment and healing and safety? Are we engaging these clients effectively? Are these practices really rooted in empathy, trying to reduce stigma, making sure we're utilizing a strengths-based approach? Are we staying patient? Are we creating an atmosphere that feels secure and predictable for the client? Just staying really encouraging, working with other people, and just promoting positive growth are at the core of trauma-informed care. In the era of COVID-19, there's some articles coming out that really talk about the importance of promoting trauma-informed care approaches with student populations now more than ever, because COVID-19 is really increasing concerns for students and professionals and families around issues of danger and safety and that need for protection, higher levels of grief and loss and worry and uncertainty, trauma, being aware of the trauma that COVID-19 in and of itself is contributing to. Unfortunately, tons of literature is coming out about a possible increase for violence and abuse in the home in the era of COVID-19. So we want to be aware of that. Be aware of any history of pre-existing traumas or disparities or adversities as well. And be aware that some of the families you may be working with may be dealing with other types of secondary traumas and adversities, unmet basic needs, economic hardship, feeling isolated. Are they on the verge of homelessness, poverty, just that economic insecurity and uncertainty? Very, very important. Digging deeper into trauma-informed schools again, are you using approaches that are promoting protective factors, promoting that in the child? Are you helping that child learn positive coping strategies? Are you helping the child to develop pro-social behaviors? Very important. So we want to promote really positive engagement, positive meanings, positive relationships, positive emotions, promoting positive accomplishments. The word positive, very, very important when we think about this. Encouragement, staying positive, very, very important. When you're working with children with disruptive behavioral patterns, again, if you look through a trauma-informed lens, I think that could be very helpful. Again, those positive, encouraging approaches, set realistic boundaries, limits, structure, consistency, making sure the environment is safe, secure, supportive. This can help teachers develop more patience and help them understand maybe some of these children that are engaging in these behaviors may actually be dealing with unidentified trauma triggers. When we think of trauma-informed classrooms too, again, think of the curriculum you're using, the way in which you interact with peers, the behavioral approaches, how the classroom is designed. Are you engaging in practices that promote social emotional learning? Is that classroom predictable? Helping build in positive transitions, learning and teaching kids how to manage their emotions, adjust the reactions to student misbehaviors. I'm not saying not not address it, but maybe look at it through a different lens. Maybe there needs to be more timeouts, more time for exercise, walking, maybe downtime, deep breathing, engaging that child, learning from the child's history, gathering information. I think really if we can promote these things, we'll have better outcomes in the classroom and beyond. When we think of trauma-informed practices, and specific strategies and approaches. Again, I've covered this, but again, being aware of cultural considerations, being sensitive to gender considerations, promoting self-determination, encouraging empowerment, utilizing that strengths-based approach. We really want to promote physical and psychological safety in the people we're working with. And just when we're looking at just trauma-focused approaches, do we come off as warm and compassionate, hopeful? Are we reliable? Are we credible? Do we have the expertise in this area? Do we utilize healthy boundaries? Are we emotionally mature? Those are very important strategies to consider when working with folks through a trauma-informed lens. Some other intervention strategies, I think, just to be aware of, again, when we think of trauma-informed treatments, again, client-centered engagement, being aware of that therapeutic alliance, promoting emotional safety, very important when we're working with people impacted by trauma. Looking at other areas we may need to address. What kind of conflict is that person dealing with currently? Are they dealing with any confusion currently? Looking at their level of shame, their self-esteem, what kind of struggles are they dealing with in and out of the classroom, in and out of treatment? What's going on in their community? Promoting positive self-regulation, helping that person learn how to express themselves in a positive manner, helping that individual develop more of a positive sense of personal empowerment, promoting coping strategies, promoting overall health and well-being. Very important. We want to promote healthy social development. Again, a lot of these things are common sense, but promoting positive, trusting relationships. Looking at the literature on promoting play among children, communication strategies, improving learning capabilities, promoting resilience, understanding what it means to have a friend, healthy friends, learning how to deal with challenges, learning how to develop trust, empathy, compassion, understanding moral development, understanding the right versus wrong, enhancing those protective factors. If you're working with families and it's domestic violence, maybe they need domestic violence types of services. If they're dealing with mental health problems, drug problems, mental health treatment, substance use treatment, maybe parents are needing help with finding a job or completing school themselves, school completion, job training programs, promoting positive family functioning, promoting resilience in that family, promoting social support, concrete support, teaching the parents about child development, attachment theory, so important. We offer a training on resilience. I'd encourage you to take a look at that, but many benefits associated with resilience. People who are resilient typically are in a better position to have more self-regulation. They may be more happier and enjoy life. They may show an interest in things, higher levels of self-determination. There is some evidence to show that having higher levels of resilience may include memory and performance, engaging in problem-solving abilities, increased creativity. It can have an definite positive impact on the person's immune system. Promoting positive protective factors, showing unconditional love in that family system. Volunteering, maybe, getting involved in sports, music, laughter, living in a stable, safe environment, establishing routines and rules and appropriate limit setting, opportunities for growth, learning capabilities, teaching moral decision making, maybe finding a hobby, having a pet. All of those things can maybe instill more hope and lead to positive outcomes. When we think of the benefits of self-regulation for student populations, I'd really encourage you to take a look at this article. Many benefits, very important. Other interventions to consider, we could spend a couple hours just digging into the literature on these, but journaling may be helpful. Promoting exercise, again, as I mentioned before, understanding the literature on child play and brain development, learning as much as possible about moral development and promoting that in children. Engaging the different senses, art-based approaches, reading to the child, having meal times together. Animals are so important, promoting happiness, Understanding the topic of gratitude, lots of research. When we can promote positive self-regulation, that can have benefits in many domains of functioning: academic performance, social abilities, conflict resolution, improved self-confidence, improved mental health, improved physical health. Looking at trauma-informed yoga, maybe exploring this as a possible option. Trauma-informed yoga it's not something that someone with general yoga training would do per se. They typically have advanced training in this. There's some training programs you can find online, but this is something to look at, and there's actually quite a few articles that have been published on this. Promoting attachment-based approaches, congruent working alliance, being respectful, promoting that empathy, being curious, showing caring, attunement, empathetic listening, very important. If you run groups in a school setting, a treatment center, art-based approaches, again, can be very, very important. Ways for that person to learn how to self-express themselves, learning how to be more attuned to their body and their emotions. Animal-assisted interventions may fall under this umbrella. Just getting movement involved, things that can stimulate discussion, learning that that person's not alone, very important. Being aware of social success, being aware of social skill limitations, promoting these areas, promoting pragmatic language abilities, promoting theory of mind, understanding the role of empathy, promoting adaptive coping strategies. I talk about this in other trainings I do, but promoting emotional intelligence, learning how to have good self-control, taking breaks, learning how to process your emotions, common sense things, exercise, nutrition, getting good sleep, having a good work-life balance. Lots of things to think about. That's another reason why we want to stay current on the literature pertaining to trauma-informed care, various types of trauma, the adverse childhood experiences research. We also want to stay current, if you want to develop an expertise in this area, on attachment theory. I think it's very important to understand the literature on developmental psychology, understanding the literature on sleep as well. So important. And I'll leave us with this, and I always try to leave this on a good positive note. Professionals who are working with people with histories of trauma, promoting self-care in the client, promoting self-care in the family you're working with, but also for ourselves. We want to be aware of professional burnout, vicarious trauma, compassion fatigue, empathy fatigue, and then just taking good care of ourselves, because if we're more regulated, we're in a better position, we can be there for others more effectively. So thank you everyone for your time today, and if you have any questions, please send me an email.